Good morning, everybody. I'm Dr. Sasikala Jain, consultant obstetrician and gynecologist in Cuddles, Secunderabad. Today, we'll discuss about travel during pregnancy. So, so most of our patients ask, "Can I travel? My brother's wedding is there. मेरे भैया की शादी है, जाना है, जा सकती हूँ क्या?" So, when we have such questions, we tell it is 80% of the time safe in pregnancy to travel, provided there are no health issues. So, but then they should know about the red flag signs where they have to be alert, and they should know when it is not safe to travel. So, they should be aware of the red flag signs like pain in the belly, bleeding PV, or there is any severe headache or water leak, any of those kind of things. And then it is not safe to travel if they have these conditions like multiple pregnancy, low lying placenta, and preeclampsia situations, and any other, if they had any bleeding PV prior to this pregnancy, or they had any preterm labor in previous pregnancies, or any other episodes in the previous pregnancy. Okay. Now, when it is safe to travel, so it is safe to travel during the second trimester, which starts from 14th week to 28th week. Why it is not safe to travel in the early pregnancy? Because people will be having nausea, vomiting, fatigue, motion sickness is more exaggerated during first trimester, and basic investigations may not be complete, because we did come across certain situations like patient was in first trimester and wanted to travel, and they didn't get the basic investigation. It turned out to be a tubal pregnancy, and she came to us with and this ruptured tubal pregnancy. So you need to complete the basic investigations and know how is the pregnancy before they travel, even if it is an important situation where they have to go. So best time to travel is second trimester, because they have freedom of moving, and the complication rates are less during that time. And third trimester, again, it is not right time to travel, because they will be more close to their labor. And during second trimester, if they want to travel, they have to take certain precautions, and the mode of travel they have to decide, and then they have to talk to their doctor before they plan their trip plans. And then they have to choose a suitable destination which may be safe for them in case of emergency, like access to the good medical center. So, mode of travel, people ask, can I travel by car? Yes, they can travel by car. If it is a short distance, it is okay to travel. And if it is a long distance, then they have to plan their travel accordingly. So, short distance, when they travel, there are certain precautions they have to take. Like they have to wear their seat belt properly if they are along the driver, in the co-driver seat. So, regarding the seat belt, it has to be, the upper belt should be across their breast, in between their breast rather, and the lower belt should be below the belly. And then it has to be properly tucked, and the seat should be little away from the dashboard, and they they have to take a frequent breaks in between every 2 hours, like that. So, and hydrate themselves properly, and they have to travel in a car which has airbags, because we know that they are healthy and they don't have any co-morbs while traveling, but then they have to be aware of possible road accidents, so they have to be safe, and the airbags give them that safety for the baby and the mother as well. So it is better to travel in cars with airbags, and then the dresses should be weather friendly and loose, so that they don't feel suffocated while traveling. Apart from that, they have to carry their own snacks which are healthy, and their own good clean drinking water, because otherwise the food poisoning issues will be there if they have street side food and restaurant. There are patients who have come with food poisoning because of having bhel puri and pani puri on the street side. Okay. And next, other mode of travel people prefer is air travel. So air travel, the plan should be accordingly done. Again, you need to talk to your doctor about it, and then you keep your medical records ready and also your prescription medications along with you. And at destination, it should have contact with the good medical center in case needed. So these are the things you have to keep ready. And then they have to plan their travel as well. So they have to reach the airport early so that they don't have to rush. And then people are worried about the security check scans, but security check scans, they don't give much radiation, and mother and baby will be safe with that. So they can go across the security check without worrying about it. And other than that, people are also worried about the cosmic radiation due to air travel. But if you are not a frequent traveler and you are not working as a flight attendant or that, then you don't have to worry about it. And pressurized aircrafts are available now, so the pressure issues and lack of oxygen is not a big concern. But during travel, you have to take certain precautions, like you have to choose the seat appropriately. So preferably take an aisle seat in the front aspect, so that you have adequate leg space and you can walk around easily. And it is advisable to walk around every 1 hour if it is a long haul flight. And also you have to take your own snacks because you may not like airline provided snacks. and and then you have to hydrate yourself well and avoid carbonated drinks. And then you have to take DVT prophylaxis, like if particularly if it is a long haul flight. Long haul flight means it is more than 4 hours of flight journey. So you have to you can wear this compression stockings, but then it had to be applied appropriately. If you have any constriction ring like while you're wearing then it will be more harmful than useful. So there should not be any folds or any constriction rings while you're wearing the stockings. And if it is a prolonged journey, then some people advise heparin before and after travel. So those prophylaxis can be taken. DVT means deep vein thrombosis for people who don't know about it. ऐसे है कि ब्लड के कैनाल में ब्लड क्लॉट फॉर्म हो जाता है और वो ब्लड क्लॉट लंग्स के पास भी चले जा सकता है और इट माइट बी डेट्रीमेंटल टू द पेशेंट। तो इसका ध्यान रखना बहुत ज़रूरी है। इसके लिए हाइड्रेशन, एक्सरसाइज ये सब इम्पॉर्टेंट है। तो जैसे बैठे हैं तब एक्सरसाइज भी करना है, एंकल एक्सरसाइज करना है ताकि पैर को ऊपर नीचे साइड टू साइड ऐसे हिलाते रहना है ताकि ब्लड क्लॉट फॉर्म नहीं होगा। Hope you have understood about that. Okay. And then during traveling, they have to hydrate again. That is very important to prevent DVT. And then people are worried about using the public washrooms while they are traveling. So you have to have mechanisms to maintain that. Like you can have antiseptic wipes, particularly while using the Western toilets, and don't hold your urine for long time in case of avoiding that. Okay, so that your chances of getting urinary tract infections will be less during travel. And again, hydrate and don't avoid hydrating just for the fear of toilet. And then it is better not to indulge in adventurous sports in case you are traveling to exotic places. Better to avoid exotic places because medical access will be less. And in case you go also, avoid adventurous sports like scuba diving and all, which is not safe for the mother and the baby because of the pressure differences. And then your choice of place should be like you should have a medical access easily and you have a contact medical person in case possible, or you can take from your doctor regarding the guidance. And then you should carry your medical records along with you everywhere. And in case of international travel, you see that there is no endemic or epidemic there. If it is there, you have to vaccinate appropriately. and then travel safely. Okay. Live attenuated vaccines are not recommended during pregnancy, so avoid them, but rest of the vaccines, if needed, can be taken. So we are done. Any other questions are there, you can get back to us. ఏమైతే రాలేదు. So finally, one more thing you have to remember is you have to have your medical certificate from the doctor before you travel. So keep that in also mind. And